Is the breast aug trend dying? Yes or no? We're here to answer that question.
No. I personally don't think so. I think the trend is here to stay. What do you think?
I agree 100%. We were doing our research, and the breast augmentation procedure has been around since the 1800s, which is crazy to think that they were doing plastic surgery way back when.
Yeah.
That's wild to me.
I just think it's one of the body parts of where you can't go to the gym. Like everyone says, why don't you just go to the gym and work out instead of getting plastic surgery? But you can't work out your breasts. You can't grow them if you're absolutely born with nothing, or people are born with like genetic abnormalities, like tubular breasts. You can't fix that unless you get plastic surgery.
And I always say getting a breast aug, it's one of the cheapest, it's one of the quickest, and it's one of the easiest surgeries to recover from.
Yes.
So with all that combined, it makes it so convenient for people to get it. And that's why when you come to LA, California, everyone and their mom literally has a breast aug. Like everyone has one, whether they're look somewhat natural or they look crazy.
Yeah, I think in our group of friends alone, almost everybody has implants. So
yeah, it's very common. So definitely no, I do not think the trend is going away. I think that the breast augmentation is here to stay.
Definitely. I will just add though, I think that because more recently people have become a little bit nervous about getting implants because they hear of the term breast implant illness. So we see a lot of people coming in the clinic getting their implants out and doing fat transfers instead. However, I still see equally amount of people getting implants. So I think it's just what your preference is, what your goals are aesthetically. Yeah. But yeah, I think it's going to be a procedure forever.
Whether you get a fat graft, whether you get a lift, you're doing something to fix the girl. So it's definitely here to stay.
Exactly.
A lot of people don't know is that there's 3 breast aug procedures in itself. We have our 2 implants that you can put in, and that's your saline and your silicone. And then you have your fat grafting to the breast, which is the 3rd procedure. Now, explain between the implants and the fat grafting.
Okay, so saline implants, they're a little bit heavier, but they are a cheaper option. So typically, that's an option for you if that's what you prefer. Or if you want a more exaggerated implant look, a saline implant would be your choice. And then a silicone implant, it's a natural feel, so it feels more like regular breast. And then also, it's a natural feel, but it's not as heavy as a saline implant as well. And then fat transfer with breast augmentation is you can take the fat anywhere where you don't want it in the body. It could be the stomach, the thighs, the arms, and then you can fat transfer it to the breast.
But that one is a little bit more invasive, obviously, because you're making an injection somewhere else in your body rather than just your breast.
Yes. Yeah. You have to go through the recovery of liposuction as well as the fat transfer.
And that's also why that procedure is a little bit more, because the surgeon has to do more and your operating room time is a little bit more.
Oh yeah, it definitely takes more time. A standard just breast augmentation on its own will take about like an hour to an hour and a half. And if you're doing like a fat transfer, because you do need a lot of fat in order for the harvest to stick. So it would probably take a couple, 2 to 3 hours, just depending on how much liposuction you're getting done.
So make sure that you're weighing the pros and the cons of each procedure, what you're looking for your body type. Ask your surgeon at your consultation, and then it will help you make the better choice for yourself.
Yes, definitely.
Yeah. Number 1 question that we get, how much is a breast aug in Beverly Hills, California? Drum roll, please.
So I would say on average from a good experienced surgeon, it's going to be anywhere from $10,000 to $12,000. That's emphasis on good experienced surgeons. Obviously, there's surgeons that do it for a lot less. I've heard of like $3,500 breast augs, which should
scary.
Raise a red flag. Yeah, and then also surgeons that do like $15,000 to $20,000 breast augs.
Which is ridiculous. At that point, you're paying for the fame of the surgeon.
Exactly. So definitely do your research. Take that into consideration. The surgery itself is pretty short, only about an hour to an hour and a half.
Yes.
So you're not spending that much on anesthesia and facility fees. And then you're mostly also taking into account what kind of implant you're using. So saline is a much cheaper than silicone, and then the type of implant as well. So there's different brands. So ask your doctor which brands they carry. There's some that are a little bit cheaper than others, but weigh in on all your options.
Yes. And this is relative to Beverly Hills. Obviously, different states, different countries, it differs.
Yes.
But you're looking at $10,000 to $12,000 in BH, maybe?
Yep. On average, it's pretty consistent.
Yeah. Post-operative care and your breast augmentation. A lot of you guys think like, oh, I'm just getting my boobs done, or oh, it's just a breast aug, it's an hour surgery. No, you still need to do your post-operative care.
Yeah, you can't just wake up beautiful and do no work.
No, you got to put in the work to make the girls look pretty. So our first most important one is wearing that compression bra for a minimum of 6 weeks non-stop. Don't take it off. Don't go to work. Don't think, oh, I could just wear a sports bra. No, you need to be wearing that compression bra.
I think a lot of people go into getting a breast augmentation so they don't have to wear a bra, and then they're like, oh shit, I have to wear a bra for 3 months non-stop. And make sure that you do that and listen to your doctor's orders.
And when you are done with that compression bra, it's very important. Do not buy any bras with underwire.
Oh, yes.
This is huge.
Yeah. So typically doctors won't clear you for 3 months to wear any bras with underwire after breast augmentation.
Yeah.
3 months.
Very important. Number 2, what are we looking for? Where we tell the girls to be checking?
You need to not be afraid to look at your breasts after surgery. They might look a little crazy. They'll be sitting high up in your chest, looking like Frankenstein boobs.
Yes.
But
Your boobs will be up to your chin and you're going to be like, oh my goodness.
what did I do?
Yeah.
But you need to take that bra off, take a look, make sure that everything is healing properly, that you don't have any abnormal swelling or bruising more on one side than the other. If you do, let your doctor know.
ASAP.
Or if any redness occurs, also let your doctor know if you're having fever, chills, signs of infection. So
Yes.
make sure to keep an eye out and make sure you're looking at yourself so you know what's going on.
Yes. Number 3, sleeping elevated. And you have to sleep on your back. I know this is like for all the side sleepers out there. I know it is difficult. Trust me. You need to get a good wedge pillow. And we're not talking about the little wedge pillows that have like a 15-degree angle. You need at least a 60 to 75-degree angle wedge pillow. You got to get a really good sturdy one so you're sleeping elevated. And that helps reduce swelling and inflammation of your chest area.
Yes, and you only have to sleep slightly elevated for the first 1 to 2 weeks, depending on what your doctor says, but you definitely have to sleep on your back for at least 6 weeks.
Yes.
You don't want to put any pressure on the breast or cause any risk for bleeding.
And our last postoperative tip is your range of motion and your pulling and pushing sensation.
Yeah, we definitely always tell patients just think of T-Rex arms. You don't want to be reaching up over your head
No.
or pulling or lifting anything heavy because, like I said, it can cause a risk for bleeding, cause a complication called a hematoma.